Hello friends, today we will study the important thing about status epilepticus. That is a new definition of status epilepticus. This definition is given by International League Against Epilepsy, which is ILE. What is status epilepticus? It is a condition which result either from the failure of the mechanisms which are responsible for seizure termination or from the initiation of the mechanism which lead to abnormally prolonged seizures after time point T1. So there are two times in the definition of status epilepticus. One is T1 and T2. What is the significance of T1? It is a time by which the seizure should terminate. That is, the condition is there. It results from the failure of the mechanisms which were responsible for the termination of the seizure, and there are some mechanisms which have lead to abnormally prolonged seizures. Normally seizures should stop by 5 minutes spontaneously, but if it doesn't stop, this time is called T1. Now T1 in case of bilateral tonic-clonic status epilepticus, it is 5 minutes. And for the focal status epilepticus with and without impairment of consciousness or in the absence seizure. So for the focal seizures and for the absence seizure, T1 point time is 10 minutes. For the bilateral tonic-clonic, it is 5 minutes. Now second time which is given in the definition, it is T2. Now, it is a condition which can have prolonged long-term consequences after time point T2, which causes neuronal death, neuronal injury, alternation of neuronal networks, depending on the type and duration of seizures. So, time T2 is the time by which seizure activity, if the seizure is prolonged than the T2 time, then seizure activity, it can cause long-term sequelae. Therefore, it is a time at which treatment should be successful to prevent long-term consequences. For the bilateral tonic-clonic status epilepticus, it is 30 minutes, and for the focal and the absence seizures, it is 60 minutes. Thank you.